There are certain things we ask you not to do for a few weeks if you have a C-section. And, yes, theoretically you can do them after a vaginal birth, but just because you can doesn't mean you should.
Hi everyone and welcome back to No Place Like Home. I am Larissa and I am your host for today. And today I'm joined by Dr. Jean Wong. Welcome back.
Thank you.
Lovely to have you back. I know that you spoke with Kath in the previous episode. We are going to continue that conversation, but we're going to do a bit more around recognising red flags. What would you say the key stages of pregnancy are that are critical for baby's development?
I guess thinking a little bit in terms of the trimesters of the pregnancy. So first trimester is about organ development, and I think even before organ development, things like development of the placenta and then growth of the baby in first trimester and laying down of all the organ structures and systems. Second trimester is a bit more about fine tuning of those things. We get things like eyelashes growing or hair growing, so a bit more baby-like. And then the placenta's growing, and then towards the end of second trimester, increased fat and growth of the baby. So third trimester then is all about that fat deposition, weight gain, muscle growth. And then at that point also the brain and the lungs are maturing, so that if we're having like a premature baby, depending on the number of weeks that the mum is, we'll be able to sort of tell you, the lungs are ready and they don't need additional support after that. And all through that, the placenta is continuing to grow. After sort of around due date and then after that sort of week after due date, there are some placentas which will start to slow down. They have limited shelf lives. So that sort of has an impact as well on the pregnancy. Yeah.
What are some of the common concerns and complications you would look out for? So maybe even we'll stay in those trimesters. So typically maybe in trimester 1, what would you see as a complication?
Yeah, I guess the big thing for mums or parents is worrying about miscarriage. And that's often due to lots of different factors. It's almost never due to what mum has done or not done. So I think most of the time if a miscarriage happens, there are always going to be women who are asking themselves, well, what could I have done better? And there's nothing really. Most of the time it's that the genetics haven't quite gone as according to plan, or the chromosomes aren't quite as we hoped. So miscarriage, I think, is the big thing for first trimester. I think the other thing is nausea and vomiting of pregnancy. That's not really a complication, but it's very unpleasant, and that probably fills up for most women what first trimester is. Second trimester, I think then a lot of medical conditions in pregnancy can start to emerge. So preeclampsia, which is like high blood pressure, or gestational diabetes. There's a condition of the liver called cholestasis that can have an impact on how the placenta works as well. So we start to see some of those things coming in second trimester. And then third trimester is often if we were going to see some growth issues, maybe the placenta's not working so well, we'd start to see that in third trimester.
Okay. What are some of the signs of complications and symptoms in pregnancy that shouldn't be ignored? So, I mean, I suppose there are the obvious things of, say, bleeding. But that can also mean a lot of different things as well, can't it?
Yeah. So I think if you have bleeding, your first instinct is to think, the pregnancy is miscarrying, but lots of things can cause bleeding. But the only way that you'll know if it is a miscarriage or if it's something else that's maybe a bit more benign is you need to come in and have a scan, get checked out. I think things like bleeding, abnormal discharge, fluid loss, like vaginal fluid loss. I think people, sometimes women think that that's maybe normal, or maybe they think it's urine, you know. I think if it's anything more than just the smallest amount, that could always be potentially early broken waters. So we need to see women for that. Yeah.
Okay.
Pain. I think there's lots of aches and pains in pregnancy.
I know. It's hard to determine what is normal, what is not. Yeah.
I usually tell my mums though, you won't know in your first pregnancy what's normal. Just call us. We can tell you, you know.
Yeah.
Or seek some help. If you don't call us, go to the hospital. But somebody will be able to tell you this is okay or this is not okay.
But never feel that like, oh, I'm calling again, or, you know, they should never feel that sort of like almost burden or, you know. Yeah.
We'll just send you home if it's all fine. That's the best case scenario.
Yeah, you'd rather have them have that peace of mind that everything's okay, wouldn't you? In all of the complications that we've talked about, how could these potentially, say, impact and manifest through labour and birth?
I guess it depends a little bit on what we're dealing with, because I think things where we worry about the placenta and it's not working so well, whether that's that it's just kind of slowed down in third trimester, or whether it's after your due date and it's just approaching its shelf life. So that may mean that the baby isn't as well grown as we would hope. It may mean that the baby doesn't have as much reserve. They're not as able to tough out the demands of labour and contractions. So we do see some of these babies have a slightly higher chance of being distressed, I suppose, in labour. And I guess small babies or babies that get distressed, a slightly higher chance of an emergency cesarean.
Yeah,
because we now have zero tolerance for any uncertainty about the baby. Yeah. So if we see any of this in labour, that unfortunately does sometimes mean an emergency cesarean.
Yeah, it's interesting that you point out that zero tolerance for sort of any, because I suppose historically they wouldn't necessarily have run to that C-section.
No.
Would they?
No. And historically, I think there's perhaps a little bit of medical misogyny as well. I think I have been doing this for a very long time, but the doctors, the consultants who trained me have been doing it for so long. And one of my old bosses used to work at the women's used to run it was like a home for unwed mothers. And so they used to have the mothers come in and stay there just before they started showing that they were pregnant. And then they would stay there for the duration of the pregnancy, have the babies, and then put the babies up for adoption usually, and then get back to their lives. Now, he was taught under no circumstances were these women allowed to have cesareans because they couldn't have a scar. So they were really hiding their pregnancies and their births. So I mean, some of the stories he told me are not suitable for public consumption, but basically none of them had
C-sections.
And so it didn't really matter about the health of the baby. It was about protecting that woman and that woman's reputation. Yeah.
Wow.
Yes, it's sobering. It's in our lifetime, I guess.
It's wild, isn't it? Because the methodology is so vastly different for almost strange reasons, isn't it?
Yes.
You know? Yeah, interesting. What actually happens to the body after birth? So maybe let's start placenta.
Yeah. So the baby's born. The placenta comes soon afterwards. So the contractions that were part of labour are also the contractions that help expel that placenta or separate it from the wall of the uterus, and then it is delivered or it's birthed. Those contractions are important for closing off the blood vessels that supply that placenta. So that's to reduce blood flow. And it's also, the contractions are also designed to shed the lining layer, the nest for the baby. So all the things that we've built up to support the baby, that's all coming out after the birth. And you can kind of tie that in with the changes of the hormones as well.
Yeah, okay.
So oxytocin is the big one that causes contractions. It increases sort of increases in labour, but also continues on after the birth. Your estrogen and your progesterone are dropping. We don't really need that anymore, although that's the thing that then causes day 3 blues, the dropping of the estrogen progesterone. But then once the oxytocin takes off, prolactin takes off as well, and those things help with breastfeeding. And those hormones will continue for weeks to months after the birth.
Yeah, wow. I'm going to try and give this a go of saying it. Uterine involution.
Oh, yes. So that's perfectly pronounced.
Excellent.
It's just your uterus returning to its pre-pregnancy size. So,
okay.
It's those contractions causing it to kind of shrink.
And that can still happen after birth, can't it? Some of those
goes for weeks. Goes for weeks after birth. So that's why I think a lot of my mums maybe are surprised they still look a bit pregnant after the birth of the baby.
Yes.
That's the uterus. And it's, I will say, look, probably 6 weeks it takes to go back to pre-pregnancy size. But maybe in the first couple of weeks, week to 2 weeks, you probably won't notice it in the tummy anymore.
Yeah, okay.
But especially second and third time mums, if you've had more than one child, you'll feel afterbirth pains.
Yeah.
And that's those contractions causing the involution just gradually. There's no hurry. And it helps with reducing bleeding as well.
Oh, right. Okay. Perineal healing. So episiotomy versus tearing.
It's probably better to tear.
Yeah. Interestingly, I tore inwards.
Oh,
not outwards.
That's actually a good tear.
And that's exactly what my OB said. He was like, well, this is good because you're going to heal a lot. You're going to heal a lot quicker.
It gets less swollen. It's less tender. You're not really sitting on it. That's actually way better.
Yeah.
So quite a bit of the research has suggested that the tear will heal a bit better and be a little bit less sore than an episiotomy. But episiotomies themselves aren't terrible, and in certain circumstances they're necessary. If we're doing, say, a forceps birth, or if the baby's heart rate is tanking and we need to expedite the birth, episiotomy is a good thing to have. But in terms of healing, they both healed the same way. So there isn't one that sort of is quicker to heal than the other. They'll take a few weeks. If we put stitches in, those stitches take about 2 to 3 weeks to dissolve. The muscle and the tissue kind of still takes a bit longer than that to sort of completely mesh together.
How do you know, doctor, how much, when you're performing an episiotomy, how much do you know? Like, what's your barometer of, okay, I'm just going to cut this much, and then, you know, as they're pushing and babies coming out, and, you know, the likelihood of them tearing more, like, how do you approach that episiotomy in knowing?
So if we were going to cut an episiotomy, we'd only cut as the baby's crowning. So that's actually kind of like the widest bit of the baby is kind of at the entrance of the birth canal, the vagina. And so what we're trying to do is cut the episiotomy when the perineum is as stretched and thin as it can be. And I think you kind of, it's a little bit technical. I don't know if if you necessarily want to hear this, but you don't want to kind of do lots of. You don't want to start with a small one and keep going to enlarge it. So you'd probably do like a small-ish one, but then we try and actually protect it. We try and sort of support that episiotomy so that it doesn't then tear further.
Yeah. Okay, fair enough. All right, let's talk C-section recovery versus vaginal recovery. I suppose healing timelines, you know, if I pull back and think about my, you know, the general chatter around C-section and vaginal. I think the common maybe misconception or it's correct is that vaginal you will heal quicker than C-section.
I don't know if that's entirely true. I think there are certain things we ask you not to do for a few weeks if you have a C-section. And, yes, theoretically you can do them after a vaginal birth, but just because you can doesn't mean you should. I think everybody should be resting after the birth, whether it's from a C-section or a vaginal birth. And I guess what you're doing is swapping one wound for another wound, whether the wound's in your tummy or, if you are lucky enough not to have a tear, then I guess you have no wound. But if you have a tear or an episiotomy, which most women will have, then that still requires time to heal and recover from. And I think you just swap where you feel that discomfort.
It's also the perception of a physical wound, isn't it?
Yes.
Because I don't think birth should be underestimated as, anything less than a physical wound at the same time. Your body's gone through this extraordinary
it's a
journey.
huge process.
And so I think that need for rest, like
Definitely.
you said, is regardless of C-section, vaginal birth, tearing, no tearing.
Absolutely.
You still deserve and need that rest, don't you?
Yeah.
Obviously, there's lots of intricacies in amongst all of these, but I think if we generally, speak.
So normally I tell my mums no driving for about sort of 4 weeks, I guess. A lot of that depends a little bit on what painkillers you are taking. You shouldn't drive if you're on heavy painkillers. You shouldn't lift anything heavier than the baby for 6 weeks. And inbuilt into that advice is the further you get away from the Caesar, the more you can do. But also I think, you shouldn't then be doing things like housework or hanging clothes out on the line or mopping or vacuuming. You shouldn't be stretching your abdominal wound. And I think that's kind of the specific caesarean recovery things we talk about. But I kind of think with my mums who've had the vaginal birth, I'd say, don't do the housework if you can get somebody else to do it for you.
Don't stand for long periods of time.
Right. Don't do the mopping. There's better things to do with your time.
Yes.
But specifically with the Caesar, that's kind of what we're doing to try and get the muscle layers under the skin all knit together
together again.
Yeah.
There you go, mums out there who've had a C-section.
Yeah, rest. Please rest.
Rest, please.
Yeah.
What should women expect during that sort of recovery and healing process? Again, if we're talking red flags, let's maybe talk about vaginal births first and any red flags.
I guess specifically for vaginal births, it would be looking at things that could happen with the tear. So whether it's starting to come apart, whether there's perhaps like a bit of discharge or extra bleeding. So mums will often notice that as increased pain, increased swelling, abnormal discharge, or an odour.
And I was going to say an odour, perhaps.
And I think mums will sort of worry about sort of infections further up as well. But that can happen after a Caesar as well.
Yes.
And that is also increased bleeding, increased discharge, odour.
Yeah.
I guess red flags with a Caesar would be worrying about the scar opening up as well. So I think, gosh, it's really just thinking about scars and making sure that they are healing together.
Yeah, I know I spoke to someone a little while ago after my operation and my wound, and he was filled with knowledge. He was a wound specialist, and he told me 12 weeks it takes for the wound to actually properly heal over. Yeah.
So I would say look after, and because we do gynecology and we look after mums who have patients who've had hysterectomies, I'd say you probably aren't feeling yourself for 3 months after a big operation. But we ask mums to go back to everything normal life so quickly after a birth.
I know. I don't know what we did here in the West, Dr. Wong, but yeah.
I have thoughts about this.
Yes, we do too.
Yes.
Hence, home exists.
Yes.
How is it best to support your body based on your birth type? So I suppose we touched on these sorts of things. I always love the rule of 5-5-5. If you're not going to do anything else, 5 days in bed, 5 days around the bed, and then 5 days just within the house.
Yeah.
I suppose that could flow over both
It could.
C-section and vaginal, couldn't it?
It could, definitely. And apart from the, don't lift anything heavier than the baby, that kind of thing, I really do feel recovery is very similar, either, from a C-section or a vaginal birth. I wonder if 5 days in the home, just in the home, probably still isn't enough.
No, I absolutely agree.
So I think I am ethnic Chinese, and we would do confinement for a month. Confinement is a very old-fashioned term.
It is, but the essence of it is so beautiful and so special.
For a month.
Yeah. We see, and we're starting to see a lot more people within the Asian community start to learn about home, and they're just like, oh my God, this is amazing.
Yes.
And it's really interesting to observe the social narrative around recovery after birth between the two cultures and how vastly different they are. And it's almost, we very much have a trophy culture here in the West. And even friends that I speak to in the US who are within the industry. And
oh, no, it's worse than the US.
It is very, horrendous in the US.
You don't take maternity leave, you just take some sick leave and get back to work after a couple of weeks.
Yeah, it's not good. It's beautiful for us as carers at home to care for everybody, but those people that do come into the space that understand themselves and, let people look after them, which is just really, really beautiful. Yeah. So did you practice traditional confinement yourself while we're on that? You did?
Yes. But I think, I did it for a month.
Yes.
I was very fortunate. My mother and my mother-in-law were around to help us.
Amazing.
But I think wherever you see, like in all the different corners of the globe where the Chinese diaspora spread, you'll find that we all practice it with different intensities.
Yes.
So I don't
because
know.
different provinces have different ways,
slightly
or
different
foods,
ways.
or okay.
So I didn't maybe do it quite as extreme as maybe other Chinese mums have done it, but I was at home the whole time. I had all the special food. There were no expectations on me. I really just looked after baby. I didn't do any cleaning or cooking. And when I had my second, I didn't have to look after my first or drop her off at kinder or pick her up or, I don't know, do
you
the
just
groceries.
recovered and rested and
Yeah.
bonded with your baby.
Yes. I was very
Which
fortunate.
is so important. Yeah, we see a lot of second, third time mums staying with us purely for that reason alone, just to take that opportunity to bond and connect with that next baby.
Well, otherwise, there's parents will say to me, "Oh, I just tucked my second baby under my wing and carried on," and I think, but your second baby is as deserving of your attention and your time. And those first few weeks are when all of that is being laid down.
Yeah, absolutely. Yeah. Well, hopefully we're on the road to reversing that and changing that on its head.
Yeah, I think you're getting there. I think home is like I don't think it will be the last of its kind. I imagine.
I hope not. I absolutely hope not. Okay, what do obstetricians look for in postpartum patients? Say at the 6-week checkup.
Yeah.
What would you typically be looking for, or what would be a red flag that you might see?
So I think initially we're looking for sort of medical recovery.
Yes.
And that would be healing.
Yes.
That the bleeding has settled or it's stopped. Mostly it's stopped. That there's no breast issues if you're breastfeeding, no mastitis, those sort of medical red flags. But I think also it's a good time to check in with mums to make sure their mental health is improving as well. I think a lot of, especially first-time parents, think, oh, this anxiety is normal, or this kind of, low mood is normal because I'm not sleeping. And look, in part, it probably can be normal, but it may not be. And there may be a better way to experience the postnatal journey. So I think it's really just checking in, I think, on all of those things. Especially I'm fortunate enough in private that I know my mums and I've seen them for a long time.
So you're kind of understanding them as a human being before, aren't you?
Before
so then
the birth,
do you feel like that enables you to see a few more things that may not be?
Most definitely.
Yeah.
And to see where, say, mums sit in their family or how their family functions, and understanding things about, say, if their partner has gone back to work and there's no other supports, and that kind of thing. We've already hopefully touched upon that during the pregnancy, so by the time I'm seeing them postnatally, I'm able to then just make sure that that's all the plans we made in the pregnancy are being followed through.
Would you say that within the patients that you have, that mental health check-in has become more than the medical?
Possibly. Look, it's certainly much more than it used to be, the mental health check-in. And I think that that's a good thing. I think in the past, maybe people didn't really, there was a bit of a stigma around talking about your mental health struggles. And maybe people just didn't even recognize that there might be mental health issues after such a joyous occasion, the birth of a baby.
Yeah, and I suppose potentially some of that, almost that stigma around like, oh, well, this is just being a parent, this is just being a mother, that potentially a lot of those things weren't maybe even brought up or discussed because maybe someone was feeling like, oh, well, I've just been told it's normal.
It's normal.
Yeah.
The other thing I see, there's a lot of mums now having fertility treatment.
Yes.
And I see some guilt with those mums because they're saying to me, I wanted this so much and I put so much effort and time into it. So I have to be happy because now I've attained my goal.
So I should be grateful. I should feel this way. Yeah, we also say that a lot.
Yeah. But that doesn't kind of allow people to acknowledge that it was hard or that, it's still continuing to be difficult.
Yeah, absolutely. What aside from the mental health, what are some of the symptoms that people shouldn't be ignoring? I think we've kind of touched on a few. Odour, we talked about the wound opening, any weeping, bleeding.
Yeah.
We didn't touch on actually postpartum hemorrhage. Why would that typically happen?
So the initial postpartum hemorrhage, it happens at the time of the birth.
Yeah.
That's to do more with the uterus not contracting particularly well.
Right.
I mean, occasionally it's to do with tearing and, extensive tears.
Yeah.
But often it's because the uterus just isn't contracting well.
Okay.
So that's something that we can deal with at the time of birth or at the time that you're in hospital.
Okay.
So the kind of postpartum hemorrhage that happens after you've been discharged, it's a few weeks down the track kind of thing. The most common cause is actually infection in the lining of the womb.
Right.
And sometimes that's actually related to a small part of the pregnancy, the placenta or the sac being left behind. Yeah.
Okay.
And that sometimes will need not just, say, antibiotics for the infection, but perhaps a procedure or medication to remove that little bit of placenta.
Okay. Before we wrap up, Dr. Wong, I'm going to ask you our question that we ask everyone. What do you think about the current state of postpartum care in Australia?
I think we could do better. I think we're very under-resourced and it's probably under-acknowledged as well, the importance of it. All over Asia, I'm sure you know this, but all over Asia, there are confinement centres.
Yes, I've done many a visit throughout Asia and all the confinement hotels.
Mums check in for a month and they are just looked after. And I'm not saying that that's necessarily for a month, or I'm not saying that everybody should have it.
I agree.
But we need to have more access to it. It needs to be more available.
It would be nice to get to a place where, you know, a week somewhere similar to home or whatever it looks like, where a mother can just rest, be cared for. You know, if that became part of just what every person gets after birth, that would go a long way, I think, too.
Also, when I worked in the UK, the midwife would come and stay with you. Where I worked, she would come and stay with you for a couple of days after. That's already a good start to your postnatal journey.
There are so many amazing models all over the world and so many statistics to support things. And I think that's the frustrating part, you know, when you can see statistically rates of perinatal mood disorders are vastly different from where we currently are because of the things that they have in place for afterbirth. Anyway, we will keep chipping away, won't we?
That's a problem for another day, I think.
Yeah, it is. Thank you so much for joining us, Dr. Wong. It was really appreciated. Thank you.
Well, thank you for having me.
This podcast represents the opinions of our hosts and their guest speakers. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast is for informational purposes only, and content here should not be taken as medical or professional advice. Please consult your healthcare professional for any personal recommendations and medical care. While we make every effort to ensure that the information we are sharing is accurate, based on the best available information at the time of recording, we will welcome any comments, suggestions or feedback via our website, contact form, home.com.au/contact. Names and details of personal experiences may have been changed to allow anonymity and privacy. To join the conversation, join us on social media at Home Postpartum.